Coming up next on Insights on PBS Hawaii, how should Hawaii's public schools educate students about sex? Aloha and welcome to Insights. I'm Malia Mattoch, your host for tonight's program. Nearly 10% of Hawaii's teenage girls become pregnant each year, a rate that is higher than the national average. And teenage condom usage here is the lowest in the nation. Advocates for sex education in our middle schools use these numbers to show that we need to arm our teens with more information to guard against unwanted pregnancy and disease. But critics of the State Department of Education's sex education programs object to how explicit the curriculum is and want the department to tone it down. How should Hawaii's public schools educate students about sex? Insights invited the Department of Education to join tonight's panel, but the department could not find a representative to appear tonight. We invite you to join our conversation by calling, emailing, or tweeting your questions and comments now to our panel. Representative Bob McDermott, a Republican who represents Ewa and Ewa Beach, has been fighting to eliminate the sexual health education program Pono Choices from the DOE's list of approved curriculums because he feels it's too explicit. Judith Clark is the executive director of Hawaii Youth Services Network, a statewide coalition of youth-serving organizations in Hawaii and the Pacific Islands. Ms. Clark specializes in teen pregnancy prevention and was a member of the work group for Pono Choices. Mike Rockers is the superintendent of Hawaii Catholic Schools, a network of 36 schools around the state offering Catholic faith-based education. The schools have advocated that parents opt out of the DOE Pono Choices curriculum if it does not align with the parents' value system. Dr. David Paperny is a clinical professor at the University of Hawaii John A. Burns School of Medicine. For 30 years, Dr. Paperny was the director of Kaiser Permanente's Adolescent Services in Honolulu. His specialty is adolescent health, including sex education. Thank you all so much for joining us tonight. Ms. Clark, if we could start, we talked about some pregnancy statistics. If we could talk about that, Hawaii being higher than the national average, what do you think is a cause of that?
Okay. Well, first of all, I would like to clarify one thing. I was not part of the Pono Choices curriculum work team. My agency does teen pregnancy prevention using other curricula that have been proven to change the behavior that reduces the risk of pregnancy and STIs. As you said, though, in your introduction, Hawaii does have a very high rate of teen pregnancy. We rank 9th highest in the rate of teen pregnancy in the United States right now, even though we have fewer youth than the average who are actually sexually active. The reason that our youth are so much at risk of pregnancy is because we do have the lowest rate of condom use among sexually active students in the United States.
And do you think programs like Pono Choices or the other programs that are going on in our public school can change that?
Yes, I do. Youth in Hawaii have inconsistent access to sexual health education. It's not required in our schools, so some schools do good work, some do none at all, some are somewhere in between. And parents, while they know it's important and they think it's important to talk to their children about sex, they themselves have not been educated. And they say, I know it's important, but I don't know how to talk to my child about this. And so part of what we do is workshops for parents and other adults about how to discuss this sensitive topic with your children. Schools are very good at teaching people facts, but it's important for families to share their values, to teach their children what is right or wrong. And those values differ among families.
All right, Representative, why are people so angry about the education curriculum in the schools?
Malia, nobody wants teens to get pregnant, especially me. I support sex education in the context of a health program that teaches children accurately about the human anatomy, physiology, and the miracle of life, human reproduction. Pono Choices doesn't do any of that. She's talking about pregnancy. Pono Choices talks to 11-year-old boys and girls about anal sex. Unless I'm mistaken, there's not an outbreak of anal sex among 11-year-olds. It talks about mouth on anus. Why are we doing this? That has nothing to do with pregnancy. That's the problem, and that's why parents have opted out in droves.
Dr. Papperny, what are your thoughts in terms of where is that fine line between adequate information and perhaps crossing some sort of boundary?
Correct me if I'm wrong, but I thought I heard you say Pono Choices doesn't do any of those?
No, it does.
I know that any of those preventative educational things, I actually reviewed some of the curriculum.
No, it does.
In fact, it presents a whole variety of different things, from choices and decision making and skill building, as well as information. And the point being that if we're going to do primary prevention, and prevention means before they turn 13 and before they're going to be sexually active at 14 or 15, which is more than half the kids in high school, then we need to do it in an age where they're receptive to it and they need to get correct information, and it needs to be graded, and every year something more. The problem in our schools is that we have a singular program like this, which is a package of 10 different units, which is presented. I presume they're going to be rolling it out at different ages, because parts of it, like you say, may not be appropriate for 11-year-olds. But in fact, the truth and the information does need to get out early so kids can process it. Kids at 11 and 12 and 13 and 14 are often concrete, which means they can't abstract and look at the consequences of actions as well. And so they need a high level of information, as much as you can give them early on. And early on really makes a difference.
And so, may I go to you, Mr. Rockers? What are your thoughts on that? Where do you stand on this?
I just think that families need to be in the center of it, honestly, in a broader sense related to human sexuality, and not just talking about reproduction and that type of thing. And as the doctor mentioned, it needs to start with the earliest, with kindergarten, talking about respect for others and saying no to yourself, being able to wait, learning about being kind and making good choices, being self-disciplined. All those things start very early, and they need to move forward in the curriculum that includes, a human sexuality piece to it.
So there's been a choice now in which, instead of parents needing to contact a school and opt out of Pono Choices, they now need to contact the school and say that they're in. Is that correct? Is that what is happening now?
Yes, the BOE came back with a policy. It says any material in the sex education programs, they need to affirmatively opt in. So what I'm hearing here, and a lot of it's good stuff, by the way, is parents need to be more involved. This gives parents more. They have to be involved now, and that's the way it should be on material sensitive in this nature. Doctor said that they should get good information. They should. Pono Choices initially, it's been pulled back 3 times for medical inaccuracies. It's a research project. Parents aren't told, hey, do you want to sign your kids up for a research project? They're told it's a pilot curriculum or a pilot project, not a human research project. Human research project requires informed consent. That's a higher level. Parents need to know that their kids are going to be presented same-sex scenarios. They're going to be told about anal sex. Anal sex is going to be conflated and presented on an equal par with male-female reproduction throughout the curriculum. And you talk about pregnancy, fetus, embryo, gestation, zygote are mentioned 0 times in Pono Choices. But anus or anal is mentioned 37 times. So people wonder why I'm mad. That's why I'm mad.
But Pono Choices is only one of several curricula that are used in the schools. And as you said, it is a research project. They are trying to find out if it is effective, because it is the first curriculum that has ever been designed to be used with Hawaiian youth. And we need to address the needs of our Hawaiian and Pacific Islander youth, because we have huge ethnic disparities in teen pregnancy in our state. The teen birth rate for Hawaiians and Pacific Islanders is 145 per 1,000 teens, compared to 22 for Caucasians in Hawaii and a little over 30 overall for the state. So we need materials that are going to resonate with that population. And so I do applaud the University of Hawaii for trying to address that need. The curriculum may need some tweaking, but I think the more core issue that we need to be talking about tonight is how parents and schools can work together to educate children, to help them grow up to make safe and healthy decisions about their sexual health. Just as we teach children how to cross the street safely, because we know that someday they are going to face the risks of traffic, we need to educate our children to be able to make good decisions about the sexual risks that they will face. And we do need to start young, because 12% of our 8th graders have already had sexual intercourse. And sex education works best if you reach young people before they make the decision to have sex. In the programs that I have worked in, by the end of instruction, we get comments from students in the end of class essays like, "Now I understand that it's okay to say no if I'm not ready for sex." All sex ed curriculum emphasize that abstinence is the best and safest way to prevent pregnancy and STIs, but they recognize that some young people are not going to be abstinent.
Dr. Paperny?
What bothers me a lot is that the opt-in component of what's been changed with this pilot program, and hopefully not for the rest of our states, and I hope it stays as opt-out, because only 3 states are opt-in, and 30 states are opt-out, which means that I'm particularly worried about the 30% of kids which end up being high risk. About 1/3 of all adolescents are high-risk teens. They have high-risk sexual behaviors, drug use, and a variety of problems, many of which are because they come from dysfunctional families, parents who are busy, have 3 jobs, or single-parent families, or racial issues, or whatever. And the point being that these are the highest risk kids, and those are exactly the families where it's going to be difficult for a parent to make this decision and actively opt in. I'm very concerned about the opt-in thing, and I think it should be changed, because the minority of states do that, and it's not good for kids.
Am I understanding you correctly? In other words, some of these families might simply not be paying a lot of attention to their children's education. Therefore, for them to make the effort of contacting the school to opt in, it might just not be happening, falling through the cracks. And has the opt-in or the amount of parents or families participating dropped since that has changed?
Well, Pono Choice has said that only 3% opted out, which means that's a 97% assent rate to me.
Does that concern you, that perhaps some families that are simply not aware?
Let me say that the parents own the school system, not me, not Doc, not Judy, not you. Well, you're a parent, you do. But so it's up to the parent to take responsibility. And anything that more engages the parent to be active in the school system, where they have to, okay, what is this program I'm getting my kid into? With Pono Choices, the problem was, first of all, they weren't told it was a research project, and then they weren't told what's in it. You know, I mentioned that stuff at the beginning of the program. Very objectionable. If you and I in a room together, I start talking like that, you call the police. No one else mentions those words, but that's what we're teaching the 11-year-old boys and girls. That's why I'm angry. She's talking about pregnancy. Anal sex has nothing to do with pregnancy, and it's medically inaccurate. The other thing is diseases. If we care about these kids, if we love these kids, wouldn't we tell them how very dangerous unprotected anal sex is? 1,800% times greater risk of HIV, male-on-male anal sex, than any other behavior. And all these scientists at the UH, we omit it. How did that happen?
Some of what you've said is not exactly accurate, because unfortunately, anal sex as well as oral sex has become a workaround for a lot of kids. In other words, as a workaround, the first experience they have is going to be oral sex, and a number of them are actually having anal sex so they won't get pregnant and they'll keep their virginity, as they say. So, and this is heterosexual couples, it has nothing to do with homosexual kids. So the bottom line is that is a sexual act which needs to be put into a curriculum, because they're 12 years old, but at some age they're going to become active, and they need to know what's going on.
Would you be willing to put the elevated risks statistically of male-on-male HIV in the Pono Choices program?
And it's exactly why it's so risky that it needs to include all those actions, because if you exclude a group or you exclude an activity, you're not telling them about that risk.
It conflates it. It presents anal sex on an equal par with male-female reproduction over and over again. And as a physician, you know there are remarkably different behaviors that have remarkably different results and remarkably different disease risks.
And
you know
kids
that.
need to know about them just as well.
The risks are glossed over because it wants to be presented.
And the fact is, some young people do actually practice anal sex, and if they are going to consider that, they need to know both what the risks are. I agree with you that anal sex is more risky than other kinds of sex in terms of HIV and other sexually transmitted infections. However, you know, it is a fact that some people are going to do it, and if they are going to do it, they need to know how to do it as safely as possible. Sex education programs do not teach people how to have sex. And in fact, at the end of instruction, the students are much more likely to say, I am not ready for sex now that I understand how complicated this all is, what the risks are, how it could derail my goals and dreams. They decide that they are not ready, but they need to have the information about what happens in real life and what the risks are.
And I would say that the information itself does not provide impetus of saying they're ready or not. I think that comes from a long line of education and of parenting and of character development and of getting natural consequences when they misbehave. And we have a family life program that goes K through 8, and only part of it is related to the human reproduction. But the choices that they make and the understanding that these young people have that's why the families are so critical, because that's the place where they learn this self-discipline, or they learn to make good choices. They don't learn that by getting information about reproduction.
But then
that's a different way to learn it.
Then of course,
reproduction is only one part of a sex education program.
And you know,
and good programs teach decision-making and refusal skills, and they get young people thinking about what they want to accomplish in life.
Many studies have shown the results of these programs decrease the number of partners, decrease the age of onset of intercourse, and decrease the amount of intercourse. So that would apply equally to everything they're taught, including anal sex. It should discourage it.
One thing, we can talk about statistics, and I can grab my bucket of statistics, and you can grab yours. Frank Fosse used to say, liars can figure and figures can lie. I can get a university professor with a bunch of statistics to prove that an elephant can fly, but we know it can't. So we have differences of opinion. We can each get statistics to back those up. But I want to go back to the parental portion of this and the opt-in, opt-out. Parents with Pono choices weren't told what was in the program. They were shown a condom demonstration. Some people think I'm a fuddy-duddy. I see a sex, okay, they're going to teach my kids about condoms. That's a public health issue. I'm okay with that. I am. I'm okay with that. That's me, though. But if you're going to tell me that I'm going to teach your little boy Mata and demonstrate same-sex scenarios to him, exponentially disproportionate to what's in the general population, 25% of scenarios are same-sex, and gender-ambiguous scenarios and gender-ambiguous names, you want to talk about confusion. What is the little 11-year-old supposed to think? And then you tie it all up with anal sex over and over and over again, and then omit the elevated risks.
So
and it's medically inaccurate.
I understand your point. Are you saying that some of this material might be appropriate at a certain age and a certain amount, or that this material is totally inappropriate?
Not for my family, it would.
So you just don't want this material?
But I don't feel strongly about this subject.
Right.
You know, you said a minute ago that statistics can lie and things. I didn't give any statistics. I simply said that everybody knows that sex education decreases sexual activity. Do you believe this?
I believe abstinence education does, yes.
Well, abstinence only increases pregnancy. Abstinence-based sex education decreases sexual activity, partners, and pregnancy.
Pono choice is not abstinence-based.
Well, you're talking about Pono choices alone.
But let's talk about abstinence-only education. The research
we don't have it here in Hawaii, so I don't think
no, we do not have abstinence-only education.
So why
we have abstinence-based education that emphasizes abstinence as the best way to prevent pregnancy and STI, but recognizes that there are other choices young people will make. However, When they compared students who went through abstinence-only programs with those that got comprehensive or none at all, the main difference, they all basically started having sex at similar ages. The main difference was that those students who went through an abstinence-only program were less likely to use protection during sex, less likely to go to a clinic and get tested for an STI, and more likely to actually get pregnant.
No. So ours are abstinence-based, which means they learn abstinence, plus they learn different skills and tools they need to negotiate and birth control when the time comes. Because you have to look at
those resulted in lower pregnancy and STI rates among the students.
You have to look at children as human beings that are developing. Someday they will not be abstinent, and someday they need to know this, and they need to know it whatever age they start. Maybe only 2% start to be active when they're 13 years old, but by 18 years old, almost everybody in high school has had sex already. So they need to have this information, well, actually, and that's in the Department of Education.
Yeah, we are an abstinence-based state, so why don't we talk about what's at hand right now, because I don't want to speculate on other programs. What we have is an abstinence-based state. It's exactly what Doc said. You teach abstinence, and then you teach these other skill sets. Where Pono Choices was a departure from that was the introduction of these objectionable behaviors I just talked about. That's the problem. And parents weren't notified, they weren't told explicitly the same-sex scenarios, the anal sex, the mouth on anus, and parents are saying, wait a minute, this isn't the health class, the comprehensive health class. By the way, we have a good program called Health Teacher in our schools. Health Teacher's a good one. I've reviewed that cover to cover. It's a great program. One or two things I changed, but it was written 20 years ago. There's no medical evidence. It's just our political correctness has changed. We need to get the same-sex scenarios in there. We need to get the anal sex in there.
I've got to say, I come from my three sons' generation. I have the same gut feeling you have about showing young children sexually explicit information. But the fact is, on their cell phones, on their computers, and in pornography, and among their peers, and in the American media, they're getting a lot more bad explicit sexual information than they could get good in schools. And at a younger age, they need to be introduced to what this is and how to make critical decisions about whether it's good for them or not. And you can bet that these sex education programs are saying anal sex has got its dangers, and you got to be aware and make them the right choices. You can't tell me that it's promoting anal sex.
It absolutely is.
All right.
It cannot be, because every sex education program which decreases the amount of pregnancy implies that if you teach about these different behaviors, it decreases their activity.
Let's go ahead. We're going to continue this conversation. Let's go to some questions and comments. Comment from Doreen in Nanakuli. I want to rename the program and leave out the word Pono. Don't abuse Hawaiian words. If it's sex education, say it. Don't hide it behind Hawaiian words that are meaningful to us. A question from Amy. Shouldn't schools make condoms available? Is that something that would ever be considered with our high rate of teen pregnancy?
I believe it's against state statute.
It is. Not state statute, but DOE policy does not allow access to condoms on school campuses. However, in Philadelphia, when they made condoms available in school health centers, they found that not only did the amount of condom use increase, but the percentage of students who were sexually active actually decreased. And I believe that's because of the opportunities to talk with the nurse or healthcare staff about sexual health and how to keep themselves healthy.
Mr. Rockers, let me ask this question of you. It's from Gwen and Kamaki. It's 2015 and Hawaii is still high on the list of teenage pregnancy. What does this say about parents' value system? I know that you've wanted to concentrate on families in this process. Where are families not stepping up that this is continuing to be such a problem here?
I think it starts initially with communication. If you don't have quality communication with your child early on, then how much harder is it to speak with them about these serious and what we feel like are sacred issues of human sexuality. So first off, it's right from the beginning having quality dynamics between the parent and the child to discuss things that are unimportant or are important. That's the first part.
And isn't it sad that so many of our parents are both ill-equipped and ill at ease about doing that?
Can I comment on that?
It is, but the ones that would have done it and are choosing to send their child to a public school or have their children in public schools, I feel very strongly that the opt-in allows them to get educated or know what's happening more effectively so they can make a decision that's best for their family.
Do you have any concerns about the scenario we discussed earlier of families that are not involved enough to know that they need to be opting out or in, and therefore there's no education going on?
Yeah, that's a concern, because you want the parents to be engaged and to make the decision consciously and a quality one. I don't think it's in providing an opt-out so that if information isn't provided at all, they're going to be receiving the services or the program.
Last week, I received a video clip of a parent of 8 children who was talking at a parent night meeting, which we hold before we do the sex ed curriculum, so the parents will be fully informed about what their children will be learning. And this father got up and he talked about, you know, how when he got the consent form, he had doubts that, you know, the school should be teaching his son these things. And he says, but it was so amazing because he started coming home and we were having real conversations about subjects that I never thought that he and I would be able to talk about. And he talked about how wonderful that was, that how it had actually improved his relationship with his son.
Is that something you'd like to see these programs?
Sure. We would like that parents make a conscious decision, and if their family mission statement, their values, lines up with what's being taught, then certainly opt in. But if it doesn't, then it's such a important matter that they need to have that ability to have it within the family setting.
I should say that in all of the schools that we and our partners across the state are working in, that we have been getting active consent from parents as well as student assent for more than 5 years now. I actually don't know how Pono Choice's creators were able to get away without doing that, since the DOE has been requiring it of us quite consistently for years. And until the Pono Choices controversy hit the media, we had less than 1% of parents who chose not to allow their children to participate. And if they did opt out, it was usually only for one specific lesson that they didn't want their children to participate in.
All right, let's go to another question from Kelly. Being that many Republicans want to reduce welfare while not supporting teen sexual health education, who will support the babies born to young mothers? Seems hypocritical to cut welfare and not educate people on how to prevent unintended pregnancy at the same time. Is there an interplay between the sort of government systems that we have to support people who might be in this situation and education? Well,
I didn't come prepared to answer those questions, but what I'll tell you is I'm married to a beautiful wife for 30 years, and out of our 8 children, we've adopted 5 of them. So, Kelly, I think I did my part. Next question.
Of girls who become parents as teens, only 50% have graduated from high school by age 22, compared to 90% of their peers. And 80% of them and their children live in poverty, many of them dependent on public assistance. The children themselves have more challenges. They fare more poorly in school. They have more chronic health problems and a higher rate of emergency room visits. All of those things are cost to society. And in Hawaii, that is costing us $38 million a year, to 71% of it in state and local costs.
So
and we can prevent that if we can get these young people through their teens without getting pregnant.
I think we all agree that one unintended pregnancy is one too many, and one STD, I'm not going to say STI, it's too politically correct. One STD is one too many. We all agree with that.
True.
Okay? We all agree. We don't want teens getting pregnant. So we have a difference in the methodologies. I'm not against sex ed. Health Teacher's a good program. I've reviewed it. It's pretty good. I give it an 80, 85 maybe. I haven't gone through them all, though. So I can't speak with the broad range of expertise that you guys get on this comprehensive system that you're talking about. What I can tell you is about Pono Choices, which
is in a very small number of schools.
Which I've read 100 times and gone over. And so that is what I find objectionable, those things that I've talked to you about before. But I would like to know one thing. You talked about Pono choices targeting Hawaiians. You know, that's what they wrote on the grant application. When we challenged them on it, they denied it. The UH denied it. That it was because we said, you're racial program. Oh, no, we're not targeting. This is for all youth. But a cultural issue, and Doc, maybe you'll chime in on this. We're measuring the Polynesians. We're asking them, we're measuring them against the Caucasian benchmark. And what I mean by that is being married to a Samoan for 30 years. To them, a teen pregnancy is a blessing. More children is wealth in the sense that you're a rich person. And I don't mean financially, but spiritually and emotionally. Children are looked at as a blessing. In Samoa, they don't have an orphanage because there's not one unwanted child. So if that other lady's question, there's no problem taking care of the children. So we're trying to change, maybe, I don't know where, I'm not, but it seems that maybe we're trying to change the Polynesian thinking to match with the white man's way because it's expensive. Well, I don't know.
There's 4 Howleys at this discussion.
Yeah, we do not have a Pacific Islander on the board tonight.
But 20 years ago, I made a computer program called the Baby Game, and it was used in high schools and stuff, and it showed kids how expensive babies are and how much trouble it is and how many diapers it takes and how much money it costs and how it changes your life and it changes your future and your goals. And part of Pono Choices in any good sex education class has to describe what the impact of a pregnancy really is. And it's different for different cultures, clearly. Goals and aspirations and dreams are different for Chinese than they are for Hawaiians. It's a fact, I presume. But we still need to let everybody learn as much as they possibly can about everything. Truths need to come out and facts need to come out. And I'm not for withholding information from anybody about any truth. If a kid's too young to process it, then they're not going to process it. If they're mature enough to understand a fact or a situation or a description or a definition, they should be given that and allowed to learn as much as they can learn.
So you think it should be age appropriate?
Of course, age appropriate.
Well, age appropriate, culturally relevant, and medically accurate.
Pono Choices was not medically accurate, as we know, and it was not age appropriate. The standard that the evaluator used, Impact International, that the UH farmed out was verbiage, reading level. Can the kids understand the words? Not the complex cognitive, psychological, and emotional benchmarks that are put in state statute that they have to abide by. And I told Madiyoshi that. I said, cease and desist, stop. And she said, well, my blue ribbon panel said it's okay. And that's what I'm up against.
But most schools in Hawaii are not using the Pono Choices curriculum. And I think we need to recognize the value of a good, balanced sexual health education program that encourages young people to talk to their parents or other trusted adults when they have sexual health questions, encourages them to think carefully and thoughtfully before they jump into having sex. And that's what sex education is all about.
And just to clarify, Representative, you oppose Pono Choices, but you're saying the other programs being used at the DOE...
No, I don't know if all the other ones. I reviewed one called Health Teacher. That's fine. There's a couple others I did a cursory examination of. They're no good, but I don't want to name them because I haven't gone through the particulars.
All right.
I got Pono Choices nailed.
All right, tonight we're having a discussion about how sexual health is being taught in our public schools. We invite you to join the conversation by calling, emailing, or tweeting your questions and comments. Call 973-1000 on Oahu and 800-283-4847 from the neighbor islands. What follows is an excerpt from a current video showing part of the Pono Choices curriculum. According to Denise Uehara of the University of Hawaii Center on Disability Studies, this video shows one of the modules that builds or progresses so that students are slowly introduced to new concepts that meet the DOE middle school standards and benchmarks for sexual health education.
So remember, when I toss you the ball, you're going to use your right thumb and read that term. Okay, here we go.
Ovaries.
What do you think, male or female?
Female.
All right, can you please put it down there and mark your papers? And the ovaries are 2 organs produce hormones that contain the female reproductive cells, which are called eggs, and they are right over here. Ready? There you go.
Scrotum.
Male or female?
Male.
All right, can you please mark your papers, male for male? And the scrotum is the sac of skin underneath the penis that holds the testicles or the testes, and it's right here.
Any thoughts on that short clip? Anyone see anything they consider inappropriate?
Why are you looking at me?
Well, actually, I've been involved in computer-assisted instruction and some educational things, kind of from a health education point of view, not an educator point of view. But I know these days it's really important to use very interactive, very high-tech educational approaches, because kids are exposed to so much stuff, and our kids are kind of technologically ADD in class, so you have to use a very high effectiveness in education. And this is an interactive method, which seems harmless to me, and it allows the material to go through, and I applaud it.
One thing that we've found is that often young people come into the 7th or 8th grade without actually knowing the proper names for their own body parts. And so most of our facilitators, before they even begin teaching the curriculum, do a lesson on anatomy and physiology so that they don't have to constantly explain what the terms are. And that is one of the reasons why it needs to start at a very early age.
Yeah. And Mr. Rockers, would you have any objection to that sort of education going on in the schools?
That type of pedagogy going on relative to human sexuality, I would. I think you'd want students to feel comfortable with saying the different verbiage and the different parts of the body and that type of thing. So you would be
supportive of that sort of approach?
Definitely giving clear, accurate information about the anatomy is certainly part of it. But in a positive, respectful way, in a framework related to the respect for everyone, the sanctity of life, but that's my schools. I'm not, I'm not saying what the public schools should do. If the parents who love their kids, send their kids to public schools, want a certain type of sexual education, and it matches up with what they want, then they should have that choice as parents, as family.
I'd like to share with you a story about what happens when young people don't get sex education. I heard this from a teacher who had a student who had entered puberty, and so her mother said to her, "Well, now that you're having your period, you better not let a boy touch you or you'll get pregnant." And on the playground, a boy's hand brushed against her, and she went to her teacher in tears saying, "I'm pregnant." We don't want that to happen with our children.
The misconceptions you're discussing are ubiquitous amongst kids. I am shocked. The kind of things that have come to my clinic over the years. I have 17-year-olds who said, I took a birth control pill every time I had sex. I have teenagers who kept the birth control pill between their knees, and on and on and on. The misconceptions will make you aghast, and if you test adults, many adults have very similar misconceptions. So it's really important we get accurate information through schools and through the proper authorities. And parents, yes, especially with values and when it comes to how to think about what your choices are going to be and the impact of the family. But when it comes to the details and scientific accuracy, I think it should be educated.
It should be in the schools.
Yeah.
We provided information to our parents relative to developmental, how to speak with your children, information to cover things so they can do things, I think, effectively in their home if they choose. And that information's out there. It isn't that it's hidden.
All right. Let's go to another question from Kelly. What is being done to protect young and old, for that matter, from apps such as the one where you can use GPS to find a person to come in and have sex with you, random unknown people? That brings up a whole nother issue, which is this is a different world than any of us had when we were in school. There's material on the internet that, goes far beyond anything we've discussed tonight. How is that working into this whole issue of children?
I'd like to comment on that. There are predators out there, and every health course or sex education course should have a predator protection module in it. Pono Choices does not have that. One of the things the FBI says that predators do is they desensitize the kids to aberrant behaviors. That's what Pono Choices did. I don't have to mention them again. They desensitize them, they conflate them, and they confuse them. And there's no predator protection module. So you all this talk about anal sex, and you're told at 11, you're responsible for your sexual behavior. Then weird Uncle Willie comes down the hall and takes you in the room and molests you. Well, what we just did, I'm told, is the same as male-female. It's natural, and I'm responsible, and there's no predator protection module. You're a target waiting to happen, and that's a problem.
Do you feel that any of these programs make people targets? Any thoughts on that?
Well, my main job now is sexual assault examinations, and the assaults occur because people are not knowing how to protect themselves in terms of, for instance, girls being roofied in bars in Waikiki, and kids who come from dysfunctional families where there have been some where there are kids who have been on the internet and they met somebody, they just met on the internet and things worked out absolutely dead wrong. The technology now really does expose younger ages to a lot more risk, and whether it's their cell phone, the internet, or the apps you're talking about, we need to really let kids at an early age know what's going on.
So would you agree that there should be predator protection guidance in every health course, every sex ed course? Pono Choices doesn't have it.
Well, the American Academy of Pediatrics
and it needs
also
to start in the kindergarten with good touch, bad touch.
Right, right.
And not just stranger
means
danger,
no.
because most molestation is done by somebody that the child knows.
That's right. So the American Academy of Pediatrics has, I think, how to raise a street smart child, and I've been promoting that all the years that I saw pediatric patients, and it's important, and it's something between parents that's very important for parents to do. Yes, sex education, but a street smart child has to be taught from home partly too.
It's also critically important to talk about healthy and unhealthy relationships. And that needs to include both heterosexual couples, but also to recognize that some young people are gay or lesbian or bisexual, and that they also need to be educated about their sexual health risks. And you can't do that if you never mention the word homosexuality.
Well, you touch on a flashpoint here. This is the problem. You are teaching in Pono Choices anal sex.
I am not teaching Pono Choices,
well,
sir.
Okay, I stand corrected. Pono Choices is teaching that anal sex is exactly the same as male-female reproduction. Let me finish. While omitting any elevated risk of HIV. So if it's homosexual behavior, the risk on the low end is 1,800% times greater. And Pono Choices also omits the entire reproductive process. This fetus, zygote, embryo, gestation mentioned 0 times. Anus or anal 37 times. I don't have a problem with a health course, sex education. I got a problem with Pono Choices and the social engineering that's going on.
So let's leave that.
Pono Choices is only one of more than 50 curricula that are available. And so I think we really should talk about this in a broader context.
So let's put Pono Choices to the side for the moment, and let's talk about how do we get that pregnancy rate in Hawaii and STD rates to drop. So can we go around the table? What are things that you actually would like to see? Would you like to see change, or what are added to the program?
I'd like to see sex education begin as early as possible, probably around age 9 or 10, appropriate level teaching, and graded, incrementally increased information in various aspects, especially, but it has to be a year or 2 before they would possibly get involved in that stuff, such that 5th and 6th grade is your minimum early age, and through high school it's going to be really how to access services.
And if something were changed at a DOE level, I understand that now it's not possible, would you like to see condoms made available at schools at a certain age?
Actually, when I was at Kaiser for many years and running the adolescent clinic, it was determined that if we had made condoms available in our male bathrooms, that we maybe have an impact on the pregnancy rate of our teenagers. So near the adolescent clinics, we put condom machines in the male bathrooms, and in fact, the pregnancy rate decreased.
And so something like that might be something to consider in schools. All right. May I ask you, what would you like to see changed, added, done to try to get these rates to be more favorable in Hawaii?
Well, I think we need universal and consistent evidence-based sexual health education for children from kindergarten on up. At the same time, we need to make an intensive effort to work with parents and families to help them feel comfortable talking to their children about their sexual health, because one of the strongest protective factors is when they have a trusted adult that they can turn to. There are other things we can do. We know, for example, that involvement in sports is a protective factor against pregnancy for girls. Not for boys for some reason, but it is for girls. That when young people have aspirations, goals, and dreams that they want to achieve, that they are less likely to engage in risky behavior. So we need to help these young people acquire those goals and dreams. Youth who are in foster care have a pregnancy rate that's 2.5 times higher than their peers. And part of that is because they often can't see any future for themselves.
20% of adolescent girls want a baby. And unintended pregnancy, 50% of those unintended pregnancies are intended.
And how do you explain that?
It's a self-esteem issue. Goals and aspirations limited to make a baby.
All right. And
they want someone to love them,
yes.
because they're not getting it from other sources sometimes.
Let me ask you the same follow-up. Condoms in bathrooms at public schools?
I think condom access should be available in public schools. I would be inclined to put it in the health room, though, where you have opportunities to do more than simply hand out the condom, but to provide a teachable moment as well. So I would make them available in our high schools, and the SMS survey that we did in 2012 showed that the majority of parents did support it at the high school level. But like I said, it should be combined with opportunities for health education as well.
Mr. Rockers, your thoughts on this?
In a pluralistic society, I understand the dynamics of the public schools and what they're called to do in relation, and it's a different situation for those parents that are choosing to enter into the Catholic schools that have a culture and a worldview so differently than the secular. One thing, though, that I would like to really all parents to understand what you mentioned was that, you know, what you encounter in experience, you think about. And what you think about, you act on. And so any way that they can keep children from too early experiencing these things on television, on the web, et cetera, that I think would help that process of, you know, self-discipline and ability to wait and not being focused on the secular world's, you know,
Clearly
that would be what I'd like to see, of course.
Religion, separation of religion and state, there's a limit to how much can be brought of some of those teaching into public schools. But is there something that works in Catholic schools that you think might be worth applying to the public sector?
The doctor mentioned it somewhat. You know, our family life program that most of our elementary schools have starts in kindergarten, it goes through 8th grade, and it looks at a broader view of human sexuality. And so good touch, bad touch, and saying no. Even when someone you know as a 4-year-old is tickling you, it's okay to say no, and it should mean no, you know? And it goes through the mental and emotional and physical and social, you know, appropriate curriculum all the way through 8th grade.
So more of that warning and protections.
And character development that will go along with the correct information, you know, the anatomical information.
Representative?
You know, we've been here almost an hour, and this is where we've come in a part of, I won't talk about parental choices, but we no longer talk about having sex, safe sex, in the context of a long-term monogamous relationship. I'm old enough to remember that if you're gonna have safe sex in the context of a long-term monogamous relationship. We automatically assume, and the sex ed program, the ones that I've reviewed, assume kids are gonna have multiple partners. Well, I have 2 little daughters. I don't want them to have 25 partners before they get married. I would be ashamed of that. Long-term monogamous relationships, safe sex in the we don't say that anymore. We don't say that anymore, do we?
Actually,
no, we don't.
We do.
Well, I haven't heard it. Planned Parenthood says that?
One of the benefits of good sexual health education programs is that young people wind up having fewer sexual partners.
Do they say in the
because they make conscious decisions about whether or not to have sex instead of thinking that they have to have sex if somebody asks them to.
Planned Parenthood says in the context of a long-term monogamous relationship.
I'm not Planned Parenthood.
Says, but it's,
well, that's
I'm not going to
quote
what they are say or don't say because I'm not
infections.
Right.
Fewer
So
partners
you
is fewer
support
infections.
that concept.
But
if you're going to have sex, it should be in the context. You would tell people that.
However, I would note that 98% of Americans do have sex before they get married.
That's not the question. I said, would you advocate, if you're going to have sex, telling kids, if you're going to have sex, make it safe sex in the context of a long-term monogamous relationship? I can't even get that from you guys.
If you are going to have sex, that is certainly the safest way to
So
do it.
You think that should be in the programs?
Well, it's
I
clear
think that students should be taught that that is the safest way to prevent unplanned pregnancy or STIs, and I want to teach them good skills so that they can make their own safe and healthy decisions about what to do with their lives, not for me to tell them what they should do.
Did you have something to add to
well,
that?
clearly, common sense and education, sex education is that fewer partners is fewer infections. And the bottom line is preventive health education requires distribution of knowledge.
Let's try to get a few questions in from Dan in Honolulu. How concerned should we be that the controversy over one specific curriculum has caused some parents to dismiss all sex ed programs? Any thoughts?
Frankly, I think it's horrifying that the controversy about one particular program is damaging so many good ones. Not that I'm saying that Pono Choices is not good, because I have not done any evaluation of the curriculum, so I would not express an opinion on that particular curriculum.
Any other thoughts on that question?
Clearly, any time parents are up in arms or it's politically, or it's known out in the media that there's a problem with the sex education program, and if parents are going to withhold that education from their kids, there's added risk for their children.
Have parents gotten more involved as a result of it? Yes. Who owns the education system? The parents do, not the bureaucrats, not the people tucked away in cubbyholes somewhere telling parents what they think their kids need to know. Parents own the system.
All right, let's get to a few comments. I'm an elementary school teacher with 25 years experience. I agree we should educate our kids as much as possible. Many are not getting the education at home, resulting in pregnancies. Comment, the panelists should stop harping on the Hawaiian community as being a problematic segment of the community. These are problems that exist across all ethnicities, and we did not have a Pacific Islander on the panel tonight, so fair enough. Is there a one-size-fits-all solution that can cross cultural and faith lines? Is there an answer to teaching this in a way that is appropriate and will please all parents, or can you just not please all parents on this subject?
I think you already have it in state statute and rules if we just follow them. Medically accurate, age appropriate, full disclosure to the parents, and the parents now make a decision. It's up to them whether to opt in or opt out. I think we already have it.
All right. There was also a question as to why the video shown tonight was not the most controversial element that's been discussed, and we did want to explain that we did request several choices, but that was the portion we were able to secure for tonight's show, just to answer that question.
Why is that, Malia?
Here's another comment. Why are they using tax dollars to teach sex? Why do our children need education about sex? That gets back to...
It's actually teaching children how not to have sex.
Sure. All right. From Kalia in Waikiki, when girls are old enough to get pregnant and boys are old enough to impregnate girls, that is the age they should be educated. Caller surmises that this would be about age 10 now. You had mentioned the age of 9 to start. I think someone else threw out some sort of gentle preliminary education even younger than that. Is there an age by which children absolutely should start their education?
Menstruation starts about age 11, and for many girls, and age 12 for some. And the bottom line is I've had a number of patients who never had their first period because they got pregnant on their first cycle. And they need to have it before their first cycle. It needs to be 9, 10, 11 years old.
Agreed?
And even preschoolers should be able to name their body parts in the same way that they talk about their nose or their elbow. They should know the words for vagina or penis.
That's insane.
They should know the words for their own body parts.
Insane. Preschool. That's insane.
What age do you feel that that's appropriate?
Well, as a parent, I'll make my own decision on that. But that general, I mean, this is the kind of thought that brings us Pono choices. This is the kind of thought when we get mandatory preschool, which may come at some point, or voluntary preschool. These are the kind of programs that are going to get in there. Kids lose their innocence. Let them be children, please.
Mr. Rockers, any thought on terms of what age is appropriate?
When you're talking about information about human reproduction, then it needs to be, before 11, 12 years old, and that's when we teach it in our overall family life program.
All right. From Kevin, choosing abstinence and being educated is a Pono choice in all depth and context of the word Pono. As a Hawaiian, the use of Pono is absolutely appropriate. I'm sorry, but is Representative McDermott contradicting himself a lot, and is he now promoting teen pregnancy as acceptable among Polynesians? And I think you were...
I don't understand the question.
I think you were referring earlier to different cultures have different expectations and understandings of teen pregnancy.
Yeah, well, you finished. Yeah.
All right. Any other thoughts just on our final moment on this topic? Things we didn't discuss?
Well, I'd like to say that parents need to talk to their kids about sex because everybody else is.
All right. Any final thoughts, Mr. Roberts?
I think parents should talk to their children about the sacredness of life and include in that human sexuality at the appropriate time things about human reproduction.
Representative, a short final thought?
Thank you for the opportunity.
All right. Ms. Clark?
Be an askable parent.
And be open and let your children know it's all right to ask questions.
You bet.
All right.
Got to start early to do that.
Everyone can agree on. All right. Next time on Insights, the Pentagon's plan to cut Army spending to its lowest level since World War I could affect 2 bases on Oahu, with about 20% of Hawaii's economy dependent upon military spending. This is causing concern across the state. What effect could the drawdown have on our economy? What can local businesses do to compensate for this projected loss in military spending? What will happen to our businesses that rely upon government contracts? And how would Hawaii's economy survive without the military? That's next time on Insights on PBS Hawaii. I'm Malia Mattoch. A hui hou. This is the after the show that they'll show